Good afternoon, everyone. This is Kerry Retland with the Washington State Department of Commerce. I'm going to start the webinar in another minute. We had around 75 people register and about 54 have signed on at this point. So I'm going to give folks another moment to register. Throughout the webinar, you will have the ability to send in written comments. So feel free, if you have questions that you want me to answer today, feel free to type those in and send them through GoToMeeting. Welcome, everyone. My name is Kerry Retland. I'm the RFP coordinator for Commerce's RFP called Community Behavioral Health Rent Assistance. It's RFP number 463P0210-01. You've probably, the two places where more information about the RFP will be posted is on the Commerce website, and on WEBS, the Washington State Procurement website. Our format for today, I'm going to walk through the RFP and address a number of things that I've already gotten questions on and share some high points of the RFP. The primary purpose of today's webinar is to collect questions from you all, provide some answers, and publish more in-depth answers in a frequently asked question addendum that I will publish both to our website and the WEBS website. I'll also identify any changes that need to be made to the RFP. As described in the RFP, we have a window of time where we can amend the RFP if anything glaring is missing or inaccurate or inconsistent. And I'm also going to use today's webinar to grow our interested parties list. So hopefully you shared your email when you registered. If you haven't already done so, send me an email at Kerry, CARY.Retland@commerce.wa.gov so that I can add you to our interested parties list. My email is on page 7, and my other contact information is on page 7 of the RFP document. And again, if you want to read along at home, Nick will be sharing some pages as I walk through the RFP, but if you want your own copy, you can find it through the Commerce website or through the WEBS website. And again, if you have questions during my presentation, feel free to send those in writing, and I will work through them at the end of this call. This webinar will also be recorded, and we'll post a link to that again on WEBS and on the Commerce website. The first thing that I wanted to mention on page 4 of the webinar is some purpose and background of this funding and this rent assistance program. We are expecting successful bidders, people who respond to this RFP, will have contractual or other formal links with behavioral health agencies to provide supportive housing services for people with long-term behavioral health needs. The primary use of these dollars in this RFP are to pay rent for people who qualify for supportive housing under the state's Medicaid waiver demonstration program through Foundational Community Supports. You'll also note on page 4 that everyone who is served through this project will be expected to be entered into the HMIS system. That's the statewide and also a national homelessness management information system, a data system that housing providers around the state and around the country use to record information about homelessness and services in all communities. Next, on page 5 of the RFP, I want to mention that I wanted to mention there's 2 bonus score areas, one to incentivize providers who are serving specific geographic areas. The reason for that is because other dollars through the same funding source are not reaching Chelan, Clark, Douglas, Grant, and Skamania counties here in Washington State. So we want to provide an opportunity for these dollars to reach those communities. There's also bonus for coordinated entry. Work with coordinated entry in these services has been challenging, and so we're hoping to start this pilot project with communities who have overcome some of those challenges. And again, there's more details about what we expect for a response to that later in the RFP. You'll also see on the same page under 1.3 minimum qualifications, successful respondents are going to be documenting a formal relationship with the behavioral health or other supportive service provider, although that's not necessarily, in some cases, an applicant may meet both of those within that organization. They also have to document a formal relationship with a Medicaid Foundational Community supportive housing provider. And again, it's possible that one applicant may meet all those requirements, although most successful applications will probably be partnering with other organizations. There are $900,000 in funds available overall for this project. We expect to award each community, up to $250,000. And then we will, and this is under 1.4 funding, and then we plan on funding an initial level and setting aside some dollars so that the highest performing communities, again, we expect to award 3 to 5 communities funds for this. That way we'll have some dollars set aside so that communities that are getting a lot of folks into units and paying a lot of rent relatively quickly will have more dollars set aside to incentivize that high performance and be able to continue to pay rent in those communities more quickly. Of course, this is a pilot. We don't have the capacity to serve all counties or statewide at this point. We're hoping that we will be able to do that in the future. The period of performance on page 6, we're estimating that contracts will begin around October 25, and they'll end at the end of this state fiscal year, which is June 30, 2019. So this is a relatively, and again, this is another reason why experience is scored so high in this RFP, because services will need to be provided relatively rapidly. Page 7 is my contact information and a key thing for you all to know, our schedule of procurement activities. So you can see the biggest key date on here, proposals are due October 5th at 5 p.m. How do you respond? How do you respond to this RFP? On page 8, which if you are following along on your own, you could key in as page 7. So if you printed the document, it's page 8. You'll see that you have to email your responses to me, the RFP coordinator, by 5 p.m. October 5th. I've also been asked about, do I need to be, or do I need to get registered for WEBS, the state procurement portal? No, you do not. Your organization can pull duplicate information, updates off of the Commerce website, and there's a URL for the web page where information is published in the RFP. And that URL is published on page 9 under 2.6, revisions to the RFP. So again, I'll be posting revisions to the RFP, including updates and a written list of the questions that I addressed today, as well as a link to the recording for this bidders call on both our website and on the web state procurement portal. Since there's so many folks on the call today, there's around 60 folks, so I want to make sure that if I'm going to probably favor written questions so that, because as you all know, a webinar like this with an open phone line gets pretty crazy pretty fast. So if you have questions, feel free to start typing them out, and when I start responding to questions, I'll be able to read from your written submissions that you send. I'm hoping to address a lot of them, though, through this quick walkthrough. On page 12 is the beginning of the proposal contents. And again, all of your proposals would be submitted by email to me by the 5th of October. A question that I had gotten earlier this week or last week was, is there a size limit? No, we did not publish a size limit to your response. Please don't make us regret that. I ask that you make sure that you cover what we've asked. A lot of our boilerplate is a little bit challenging to begin with. We've tried to keep things as simple as possible and also collect all the information that we want in order to ensure that you are qualified and ready to provide these housing services as rapidly as possible. In that project approach or methodology on page 13, it's important to us that you explain in your proposal response how you're going to prioritize the target population. That population is defined at the beginning of the RFP under 1.2, under scope of work. How your team will ensure effective services to individuals. Again, what we anticipate is a proposal from you that describes how a housing provider is coordinating referral services with Amerigroup and or coordinated entry, and how those organizations are coordinating with behavioral health organizations to ensure services are provided to those individuals and that housing services are also coordinated. Because of the population that we're serving, we know that these folks are going to have high needs, so we want to make sure that your proposal anticipates that and has support services coordinated locally to ensure that people's needs are met as they're placed into housing and supported locally. I noticed that a few of you have your hands up, and that's great. I encourage you to use the chat function in the webinar to send me written questions, and I'll try and I'll check them out as I'm walking through the RFP, or by the end of my walkthrough, I'll start taking your written questions. On page 16, I mentioned the evaluation weighting and scoring. It favors experience of the RFP respondents. And that is, again, that is because that this is a pilot program, and our hope is that we are contracting with organizations that are, in many ways, that can demonstrate experience working with this population, supporting this population, so that they can get up and running fast and we can get red assistance to those individuals as soon as possible. Commerce hopes that we will get more dollars for this in future years and we can expand to other communities. But in the short term, we're hoping to provide supports and services through this contract to organizations that are already doing some or most of this work, and we're incentivizing more coordination, again, with supportive services providers, housing providers, and individuals who qualify for foundational community supportive housing. I already talked about the bonus points. They're also mentioned again on page 16. Again, there are, we're encouraging, we'd really love to see communities apply that are working to serve this population and provide referrals through coordinated entry locally, so there's bonus points for that. We're also providing a geographic bonus to counties that are not currently eligible for HARPs, since these funds are connected to other supportive housing dollars that we're also currently contracting with the Healthcare Authority to provide a deep subsidy related to HARPs. So we're hopeful that those counties, which are Clarks, Gamania, Chelan, Douglas, and Grant, are incented to apply through that. The last thing that I wanted to bring to your attention, so beyond that, there's a draft of kind of our boilerplate contract is included as Exhibit C in the RFP. But really the big thing that I want to make sure that everybody sees in that is on page, it's the last 2 pages of the RFP. So it's attachment A of that contract, which is Exhibit C, and it's shown at the end of the document. It's shown as page 14 and 15, but it's really more like 38. But that's the scope of work. That's the draft scope of work in the contract, and there's a lot more. There's a little bit more in depth in there. That scope of work is based on and expands what is in section 1.2, the objectives and scope of work. So that more detailed scope of work is what we will be expecting of contractors. Make sure that you review that and reference that as you're putting together your proposal. There's a little bit more detail in each point of that more broad purpose and scope from the introduction of the document in that contract addendum and that draft scope of work. I don't have any written questions sent my way yet through the chat function, But if you have questions, now is a great time to write those up and send those in so that everybody can see your question and I can respond to it. Again, if it's relatively straightforward, I'll address it today. If not, I'll make sure that I address it when we publish an FAQ and, if needed, an amended RFP later this week. I'm looking at some raised hands. I'm seeing Crystal Alderman. I see that you may not have a phone connection. We're going to unmute you for a moment. But again, if you don't have your phone logged in, or if you don't have your chat function turned, oh, it looks like maybe, I think we've found your question perhaps. Great, I see a question about HMIS software. Different communities are using different software to provide HMIS, and I'll provide a little bit more detail on that after the webinar. And I can also provide information about our statewide HMIS coordinator if you have questions about that. The next question's about what counts as a behavioral health specialist provider. So really, those services are going to be determined by individual needs in your community. Some service providers will be related to mental health. Others will be other services may be related to physical or other disabilities, and some providers or relationships will serve a person's chemical dependency needs or treatment services related to chemical dependency. So there's lots of different sorts of providers. There's not a licensing requirement or anything like that. Really, we want to make sure, and again, the most successful bidders will be able to coordinate support services with lots of different to meet lots of different types of needs in the community based on what individuals who qualify for foundational community supportive housing, what those individuals' needs are locally. Sharon, great question about eligible but not approved households. Yeah, I think that is something that we would want to provide flexibility on, right? We don't want to leave a provider in the lurch. You know, the purpose of the reason that we provided that flexibility, and I'll try and find a page reference here for where this question is coming from in a moment, but we want to make sure that that these dollars are flexible enough so that you can help an individual get housed as rapidly as possible. So it is possible that, based on Sharon's question, someone who is an individual who is eligible but not approved could then be denied for services, or may not end up being eligible. And again, that's something that it's something that I don't anticipate happening very often, but something that we would want to make sure that we, since you would be providing that service in good faith, that we're responding similarly and supporting you to do that. I think another challenge to that would be, how long can we pay rent assistance for that individual? We'll have to work that out on an individual basis when it occurs. Can we use this funding for foundational community support, supportive housing households that are already housed but having trouble paying the rent? Great question, Sharon. The focus of this will be to get individuals housed who are currently transitioning out of treatment or are not housed. But again, yeah, we'd want to provide some flexibility for making sure that we keep individuals housed if a household that qualifies for these services is experiencing a crisis and not able to pay their rent. So yes, that although not the focus of this dollars, making sure that people stay housed would also be an interest to us, and is something that's not specifically addressed right now, but it certainly is something that we would negotiate. We have negotiated that and are doing that in kind of this project's sister contract through HARPS. Deborah, it looks like you may have found a math error on my part in the evaluation, weighting, and scoring section on page 16. I'll look at that and make sure to follow up on that. Thank you very much for bringing that up. Yeah, and again, I just wanted to follow up on the question about the evaluation, weighting, and scoring under 4.2. It looks like there's an error in my math there, so I'll need to correct that in issue and update. So thanks for bringing that to my attention. Term of lease, great question, Sharon. Thank you very much. We don't have a requirement for that right now, so we will have to consider that and issue a response to that question in the FAQ and in an addendum. Thank you. David, you have a question about age range. If you would like to include that in your proposal, that's fine. As far as specifying subpopulations and targets that you may be setting based on the age of your populations. This part of foundational community supports serves individuals age 18 and up, and as many of you know, the housing needs of young adults and service needs for young adults 18 to 25 is quite different than other populations, and so we'll be looking for proposals that that if you are providing services to to young adults, that you are aware of that and anticipating providing services or coordinating with service providers who have expertise in serving and supporting young adults. Shirley, great question. Thank you very much. This is a statewide RFP. Since a sister contract through the Department of Commerce, similar dollars, right now are not providing services to 4 counties. Those counties have a little bit of an edge. They get 5 bonus points in their proposals in this contract. So any jurisdiction or any community is qualified to respond as long as they meet the minimum qualifications. But there is an incentive, a 5-point bonus for services being provided in Clark, Skamania, Chelan, Douglas, and Grant counties. Again, because a sister contract that Commerce is funding is not serving those communities right now. Laurel, great question about timing, we addressed that to some extent in the RFP, but I will follow up with that in writing as well, and I'll look again at our RFP requirements around timing and contracting. Laurel's question is, since the contract starts very soon, do you expect that the grantee will have a fully executed agreement with the mental health provider by then? Again, we do provide some specific requirements in the RFP, and I will highlight those in the frequently asked questions that I publish later this week. Darcel, I'm looking at your question, and I'll do my best to address it. Are you looking for 1 or 2 agencies in an area, or would you entertain going with multiple smaller agencies? We do not have a preference. I think it's certainly possible that a geography could send in multiple proposals from different organizations. Although currently, Commerce, for the most part, services other contracts for housing services, like consolidated homeless grant contracts, are primarily provided through counties, which also reflects how HMIS systems work in most communities. There are some exceptions, like the Spokane area. So because of the HMIS requirement, I would guess that some municipalities, would coordinate. But that's not necessarily the case. It's certainly possible that we could get competing applications to serve the same jurisdiction. So we don't have a preference, we would entertain multiple applications from, and we don't have a preference on, I don't know that I'm answering your question, Darcel. So feel free to email me more detail and I'll take another crack at it in the frequently asked questions I publish later this week. Many costs related to housing in this contract will be cribbed out of the Consolidated Homeless Grant and those contracts. So details like move-in costs, landlord incentives, other details like that related to housing costs will be echoed from those funding sources and contracts that Commerce has, and through, and so a lot of questions about what is payable as far as housing expenses are concerned, we would crib right out of the Consolidated Homeless Grant guidelines that are published on the Commerce website. There's a little bit more detail in reference to that in the scope of work that I mentioned, which is on the last page of the RFP document. It's attached to the draft contract. Deborah, yeah, thank you. I'm seeing your question about my math on the technical proposal. And I super appreciate you bringing that up so that I can correct that. There's a math error on the way that the technical proposal is scored on page 16 if you've printed the document of the RFP. So in that evaluation and weighting, which is 4.2, section 4.2, page 16, I'll have to correct that and upload an amended RFP and make that change or fix that math error. Thank you. Jeremy, I'm looking at your question, which is, we currently help to provide employment opportunities through FTS, but we've not worked in the supported housing aspect of it yet. Is it correct that those already working in other capacities to help place individuals in housing will be given priority? What we're looking for in the application is that applicants are ready to, that, you know, under 1.3 on page 5, that applicants have a formal relationship with a behavioral health or other service, supportive service provider at the time of contract execution, and which is the fourth bullet down goes on to explain that we expect that an applicant has documented a formal relationship with a Medicaid foundational community support supportive housing provider, again, at the time of contract execution. So if you're already doing that, great. If you're working on getting that going, that's great too. Again, this is so those are minimum qualifications. But again, since experience weighs heavily, applications that have been providing those services or have been doing that will likely be scored higher in the experience section than those who have not. You know, hopefully that helps address your question. Emily, great question about how long do you anticipate providing rental assistance? Well, this is intended to provide long-term supportive housing services primarily through rent supports. The intention of this is to be to help provide this last piece of long-term supportive housing and basically rent assistance in the long term for many of the individuals who we're hoping to target, who qualify for supportive housing through FCS. The dollars that these are coming from the State General Fund through a proviso. Again, we have requested more dollars related to serving this population through the governor's office, but we won't know until next spring whether or not those dollars were included in Commerce's budget. So we're very hopeful that at least these pilot communities will be funded again next year, next fiscal year. We're hopeful, and we've requested that we expand these services. But like any state general fund project, it is difficult for us to be able to make any sorts of promises about what's going to happen, since the legislature's session and the budget related to this work in future years has not been created yet. Monica, great question about HMIS and consent, non-consenting individuals, privacy. I'll have to respond to that question through the FAQ. I am by no means an HMIS expert, so I'll work with our experts to get you a good answer in writing later this week. Lisa has a question about, since this is for the first year pilot round, how many grants do you anticipate making to counties that already have a HARPS provider, if any? It's really, we don't have a sense of that yet, since I don't know how many applications we're going to get. We're anticipating awarding 3 to 5, but that may change based on how many applications that we get. So the only thing that, the only jurisdictional assumption that we have, or incentive that we've offered, is published in the scoring, those bonus points for communities that are not currently receiving assistance through HARPS, the counties that I've already mentioned a couple of times. So that's not much of an answer, Lisa, but that's the best that I can do. We can't really know that until we receive applications. Zay, your question, is this truly a Housing First model? Both Housing First and supportive housing fidelity through SAMHSA are what has helped shape some of the goals of this project. However, this population was really identified as a priority through a funding proviso in the state operating budget. So that's where the dollars come from, and that's how we targeted this population. The legislature really wanted us to provide more dollars and assistance for people who are exiting institutions and some of the other high priority populations that are highlighted at the beginning of this document, again on page 4 under 1.2 objective scope of work. Aaron, another question that I've kind of already addressed about expectations for supporting these families in future years. Again, we can't know, since these are general funds, and right now we're contracting for the second year of our biennium. we can't make any promises for any general fund projects. We're very hopeful that these dollars will continue next fiscal year. They were part of our budget request to the governor, and we've also asked for additional dollars to serve a very similar population. So we're really hoping that this is the beginning of that this is a pilot for expanded services in future years. But I cannot make any promises that these dollars will continue. Again, I'm very aware that we're really interested in building long-term supportive housing, through scattered site placement for these individuals. So we're very hopeful that these dollars will continue, will appear in future budgets, but I certainly can't make that promise. We have a question about how this rental assistance is being marketed, given the short-term nature of the assistance. I think that's part of what we're asking respondents to tell us in their proposals. Many communities around the state are already having a lot of success in competing against individuals and with private market landlords who may be able to, who are also getting applications through, from individuals who are not on public subsidies. We're hopeful that successful respondents have experience competing with private market landlords or others in order to find suitable placements for individuals who qualify for this project. Question about, can a single agency who provides services in multiple counties apply to each? Yes, there is no prohibition of that. Can we bill for indirect separate from admin, or does this all fall under administrative costs? Great question. I'll respond in some detail to that in writing, but that brings up an important point that I wanted to share. Related to eligible costs. Sorry about the dead air, everybody. I'm looking for a reference in here that I wanted to explain that I forgot to mention that Sharon's question has brought up for me. Well, anyway, I can't find it, so I'll have to make sure that I publish it for you all to see. The short of this is that one of the many things that we've heard from supportive housing providers or shorter term housing providers around the state is that one of the challenges of providing longer-term supportive housing is being able to bill for on-site staff or a front desk staff, other services like that that are important to providing supportive housing, but that are challenging to bill for. So that is something that we identified as a cost that has a limit, but that can be billed for through this RFP. And I'll provide more information in the FAQ about where that can be found and what the limits are for that sort of funding. Craig, yes, we are hoping that, and it's part of the MNQUALs, that organizations have a formal relationship with behavioral health or other service providers at the time of contract execution. So we will be looking for that in scoring, well, and that's a minimum qualification. So we're going to want to see demonstration of that in order for an application to meet the minimum qualifications. So does an organization who's applying have formal relationships with behavioral health or other supportive service providers? And as I mentioned before, those supportive services could include other services related to a disability that aren't necessarily related to mental health or substance use treatment. Riley, great question about target number of clients. We require that you estimate that in your proposal, but the short answer is, well, our legislative proviso, yeah, provided a real high level expectation of beds, but that was not published in the RFP, and we don't have an expectation of that. So the number of individuals served, so we certainly, I think a question within that question, Riley, is, you know, is there an advantage to being an organization or a jurisdiction that is providing potentially more services because you're a larger urban area? The answer to that is no. You know, we don't want number of individuals served to discourage a smaller jurisdiction from applying and competing for these funds. Great question about existing relationships that are not a written contract. So what we're interested in that you are documenting and explaining in your minimum qualifications is that you have a formal relationship with some sort of supportive services provider. It doesn't have to be, that formal relationship does not necessarily need to be contractual, but certainly that's an easy example of a formal relationship. There's other ways that you can document those relationships through interagency agreements or through financial agreements or through rent assistance or other services or supports like that. But it does not necessarily need to be contractual. And of course, existing relationship would help, would address that min-qual. Aaron, great question about, are these funds available to assist with non-reimbursable behavioral health services, such as mileage to and from housing in order to provide mobile on-site services? That specific example is not currently addressed in the RFP. I'll have to follow up in our FAQ to address that question specifically. I mentioned there are some other things that we do want to make sure that we can pay for through this. Again, like some expenses for on-site staffing, since that is one of many things that are not billable elsewhere, since that's an example of the sort of things that providers who are interested in providing supportive housing have struggled to find a way to support. So, Aaron, I'll address your question in more full in writing later on. Okay, thanks so much for pointing out that that language that I was looking for is under 1.4 on funding on page 5. So again, because operational staff time for housing search, landlord liaison, and other supportive housing services are, no, the next paragraph down, administrative charges may not exceed 15%. And then there's a list of allowable administrative costs. And you'll note that unlike some other contracts or grants, this project will pay for organizational costs like rent depreciation, operations, maintenance, and agency staff that provide on-site or on-call services, front desk, clinical responders, things like that. Sharon, great question about other supportive services category, and I'll provide more detail on that as well in writing when we publish our first FAQ later this week. I'm not seeing any other written questions, and we're out of time. So again, the Q&A period for this RFP is still open, so please send me questions at my email, carrie.retlin@commerce.wa.gov. And when you email me, make sure that you ask me to sign you up for the interested parties list so I can send you notification when our frequently asked questions or this RFP is updated. And again, the updates will publish both on the Commerce website and on WEB's, the state procurement portal. Thank you all very much.